Okay, just two last brief things on PTSD, and I am highly conscious that there's a lot of content just associated with this diagnosis. Um, so I'm aware of that for the reasons we already talked about. Um, all right, so two quick things. Um, Definitely that there's suicide risk in the way of like someone may contemplate suicide very consciously and even sadly sometimes plan it because they I mean we can never know for sure and completed suicides of course, but observationally it's so hard to can be so hard to live with, and the symptoms can just people start to think that they're never going to feel better. Of course that's not unique to PTSD, but it seems to definitely something that seems to come up in PTSD because it can be very, very um, debilitating in terms of distress and functioning. But the other thing that can happen is that I often also see people who are not, don't have like that, suicide ideation or contemplation of suicide, sort of consciously planning suicide, but are just um, uh, really given to high risk behaviors and more of an indifference to their own safety, not even necessarily in a mortality kind of way, but just indifference to their own safety. For as much the same reason, just bending under the weight of the symptoms associated with PTSD, in PTSD in particular, but certainly even with, just dealing with significant trauma that doesn't necessarily meet full criteria for PTSD can create just a indifference to their person's own safety or mortality, which can be distinct from suicide ideation in the way we typically think of it. Um, so just something to just offer you to consider in your travels, particularly if you're working in people with serious traumas. Um, the last point, and I think it was something we've already touched on, is that if criteria A is met and nothing else is met, um, uh, usually, I don't think I've ever met anybody who's would have had an experience or a collection of experiences that would fit criteria A and not benefit from professional support. Uh, and Yeah, I mean, just never seen that. So it's certainly just to end on a point that we've already made that someone can not have a diagnosis or not fully meet the criteria for PTSD or acute stress disorder. Sometimes adjustment disorder can end up fitting better if someone is definitely struggling with severe trauma or even just severe stress, severe life stressors. Um, that just because they don't meet full criteria for one of these traumatic trauma stress related disorders doesn't mean that they could really benefit from professional help and really need it. So you guys probably that's probably something that's easily understood by you guys, but not necessarily by lay people, and sometimes not understood by your clients either. So anyway, so that is the last thing specifically on PTSD.